Good morning, everyone. It's so nice to be here. Thank you for having me. And so I think as everyone in this room is quite familiar, that the issue is that 1 billion children experience violence annually, which is a massive number, about half the children in the world. So violence against children, again, as I think you all know quite well, has consequences across the lifespan. Let me just... of course, there are injuries associated with the violence at the time it happens, but also a host of other outcomes, including chronic disease, sexually transmitted diseases, and sexual risk behaviors, social and economic challenges, as well as pregnancy complications and mental health issues. So as a result, it's what we would call in public health a linchpin issue, and addressing it can have profound impacts for children to help them lead healthier, better lives. So I work on the Violence Against Children and Youth Survey, which is a national household survey, which I'll be talking a lot about. And it all began in Swaziland in 2007, Swaziland now known as Eswatini. And the government of Eswatini was interested in understanding the relationship between sexual violence in particular and HIV, given that it remains the country with the highest HIV epidemic in the world. And so a national household survey of violence against children had not been done to that point, so they reached out to UNICEF and CDC to ask if this might be possible. And so the very first Violence Against Children and Youth survey was conducted in Swaziland in 2007. And since that time, it's been completed in a number of countries, mostly in sub-Saharan Africa, but as well countries in Southeast Asia, Europe, as well as the Caribbean, and we're piloting the project actually for the first time in the United States in the city of Baltimore, coming up very soon. Also, since that time, we've had a few countries repeat the survey, which has been particularly valuable in understanding the change of prevalence over time. But you can see that most of the data is from the sub-Saharan Africa region, so they really do have the best data on national violence against children prevalence rates of any part of the world. So the Violence Against Children and Youth Survey, or VACS as we call it, is really a tool that catalyzes action. And I think that's well evidenced by the fact that Swaziland conducted the survey in 2007, and quite soon there were a number of other countries that were asking for technical assistance to do a survey of their own. And so the way the survey works is a lead government ministry will lead the survey, but because violence against children touches so many parts of their lives, there needs to be multi-sectoral engagement from across the government, as well as from universities, NGOs, civil society, and other partners in country, and then as well, multilaterals, agencies, and US government providing technical assistance. So the surveys are really an advocacy tool where the government, the host government, will for the first time have the prevalence data on this key issue, and it truly does break the silence that often surrounds something as stigmatizing as violence against children. That in turn will start a conversation, and that conversation leads to action in the form of national action plans, typically, that work to prevent as well as respond to violence against children. So as I mentioned, the VACS are a national household survey. We survey 13 to 24-year-olds, males and females, except in Swaziland, the original survey, we only interviewed females, but since then we've included both males and females. Now, we do interview 13 to 24-year-olds for a very specific reason. 13 is determined to be the age at which young adults or children can comprehend the questions, which are quite complicated in some parts of the survey, and up to 24 to reduce recall bias. But it is a retrospective survey, meaning that we're asking them to recall across their lifespan. It's a 3-stage cluster sample survey design, meaning that we randomly select primary sampling units from throughout the country, and then within those primary sampling units, we select a random number of households. Typically, the cluster size is about 25. So of the households in the primary sampling unit, we'll select about 25. And then from within the household, we will randomly select an eligible participant if there's more than one. Given the sensitive topic, we don't want to be interviewing multiple household members within the same household. So the survey is carried out by in-country institutions. It's been everything from universities to government ministries, NGOs. Really, it's up to the country to determine who is best placed to implement the survey. Again, given the sensitive topic, as well as the vulnerable age group that we're interviewing, there is an extensive training. And interviewers are carefully selected and then receive a lot of instruction on how to operate the survey in a way that will be safe for the participants and lead to high disclosure. As you saw on the map, given the context of where most of the data collection is happening, this overlaps very much with countries with high HIV prevalence, and we know that there's a strong association between HIV and violence. And so in many of the countries, HIV testing is also offered, so we can really understand that link between violence and HIV. And then those respondents have the opportunity to receive their HIV test results, and if they're positive, be linked to care and treatment. So the objectives of the Violence Against Children and Youth Survey are first and foremost to assess the burden, so to understand what is the prevalence of violence against children, and as well to understand the context of how it's happening, where it's happening, who the perpetrators are, what are the health consequences. And again, we interview out to 24 so that we can look at violence that happened before the age of 18 and then understand for those people what the health consequences have been for them, including mental health, substance use, sexually transmitted infections, and a number of other health risk behaviors. We also look to understand risk as well as protective factors, so specifically the social context in which these children and young adults live, to understand what might be the relationships with their family and their community that might protect them or in turn put them at greater risk for violence. And then we want to understand when they are experiencing violence, do they know where to go for services? If they do know where to go for services, are they trying to get services? And for those who do try to get services, are they successful? And then, as I mentioned, given this association, this intersection between HIV and violence, trying to understand that a little bit better in these countries to help inform not just the violence prevention efforts of that country, but also the HIV prevention efforts. So again, the survey is a violence against children and youth survey, so we specifically ask about physical violence, sexual violence, and emotional violence. And then we try to understand these risk and protective factors, which are very important for informing programmatic and policy response options. We want to understand what are the health outcomes that children who experience violence might be predisposed to, and then associated risk factors, HIV risk behaviors, as well as their interaction with HIV testing, care, and treatment, and then also things like gender attitudes and norms that might, again, predispose children to violence. All right, so how are the surveys implemented? Again, it's the host governments that really are in charge. They determine when to do the survey, where to do the survey, how to do the survey. And then my organization, the U.S. Centers for Disease Control and Prevention, or CDC, we provide technical assistance to them throughout the process. And for the most part, the funding has been through PEPFAR, or the President's Emergency Plan for AIDS Relief, which is one of the largest HIV prevention funding mechanisms in the world, and in turn funds most of these surveys. So now to talk to you a bit about some of the findings across the countries where we've implemented the survey. there's a lot on this graph, but really I think the takeaway is that sexual violence happening prior to age 18 is highly prevalent throughout the countries where we've implemented the survey. For girls, ranging from 4% in Cambodia all the way up to 38% in Swaziland. And then for boys, ranging from 6% in Cambodia all the way up to 21% in Haiti. So generally, in many of these countries, about 1 in 3 girls will experience sexual violence before her 18th birthday. For boys, it is a bit lower, but still, I think most would consider it to be unacceptably high, particularly given the health outcomes that we know are associated with violence across the lifespan. So as I mentioned, we want to understand if these children are receiving services for the violence that they face. And so when it comes to sexual violence, in fact, most of them are not. Less than half of boys and girls know even where to go to receive services. And of those, ultimately, only about 5% of girls and 4% of boys receive services. So now to talk about physical violence, where the pattern for sexual violence is, in most countries, statistically higher rates of sexual violence for girls compared to boys. That's often flipped when it comes to physical violence, with boys experiencing more physical violence, particularly peer physical violence, as well as physical violence from caregivers and teachers. But regardless of this difference between boys and girls, again, it is still unacceptably high in most countries. Up to 3/4 of boys in Zimbabwe are experiencing physical violence before the age of 18. And then emotional violence ranges from 16% in Zambia to 35% in Haiti for girls, and 20% in Zambia up to 39% in Zimbabwe for boys. Emotional violence is sometimes regarded in the field, by lay people as maybe less consequential, when in fact I think many of us in the room understand that emotional violence can actually have some of the more severe health outcomes, particularly mental health outcomes. And then just to give you a sense of the norms and values, in most of these countries there's a high endorsement of gender-based violence. So among young adults, for females, about 41% in Haiti, and 39% in Nigeria endorsed domestic violence in one or more circumstances. So a high acceptance of violence as a means of interacting within families, within communities in most countries. And then, again, there's a lot packed into this slide, but I think the key takeaway here is that suicidal ideation in the past 30 days, so a really troubling statistic, and we find that it's statistically significantly higher among those children who've experienced sexual violence before the age of 18. So just for example, in Swaziland, about 25% of those who've experienced sexual violence before the age of 18 have had thoughts of suicide in the last 30 days, compared to only 10% among those girls who have not experienced violence. And the asterisks indicate where we see statistically significant differences across these countries. And then sexually transmitted infections, so a serious public health problem around the world, but again, HIV, particularly in sub-Saharan Africa, we do see, again, this relationship between violence experienced in childhood and higher rates of sexually transmitted infections in young adulthood. So again, the asterisks are where we see statistically significant differences, but the pattern holds across all of these countries, that those children who've experienced violence before the age of 18, sexual violence before the age of 18, are going to have statistically significant, in many of these countries, chances of sexually transmitted infections in young adulthoods. Okay, so the VAX, the Violence Against Children and Youth Survey, is truly a global health research tool that provides countries the information that they need to make change, to improve the situation for the children and young adults who live there. But it's also a global tool to really understand what these patterns look like. So the survey is really designed to provide the country's information, but certainly not to stop there. The next thing that happens is what we call a data to action phase of things, where the country will be handed their results and then will really work across sectors to prioritize the data that they feel like is the most actionable, the most important, and then using the World Health Organization's INSPIRE technical package, match those priority data points to evidence-informed programs that they can introduce or scale up or evaluate in their own contexts. So typically what happens is if the countries don't have, and often they don't, have a national action plan around the prevention and response of violence against children, then the survey will truly catalyze that. Or in some cases they do have, but then the survey data can be overlaid on top of their national action plan, and they can determine if the roadmap that they've set for themselves is appropriate or if they need to make adjustments based on what the data are saying. So again, the survey can really assess where is the critical points in this country to focus efforts. And then through these workshops and tools, the country can go through this effort of prioritizing data and then really identifying what is the evidence base for those prioritized data points, and then doing things like cost estimation to understand what it would take to move forward with those goals, and build in as well evaluation. As I mentioned, INSPIRE is the World Health Organization's technical package that was developed in partnership with a number of other UN agencies as well as US government and other partners to really look at the evidence base of violence against children and identify those tools and programs and policies that are most effective. And the letters INSPIRE stand for the letters of the technical package. So the first I is the implementation and enforcement of laws, norms and values, safe environments, parent and caregiver support, income and economic strengthening, response and support services, and education and life skills. And so basically INSPIRE represents the best practices for preventing and responding to violence against children and youth. But there's also actually a lot of overlap between violence against women. And so with the Violence Against Children and Youth Survey, we generate evidence as well for violence against young adults. And so these programs often translate to that population as well. And again, reflects the best evidence of what we know works. They're actually, the secretariat that works on INSPIRE is going through a process right now of updating the INSPIRE toolkit since it was first created around 2015 to add new programs. And as I mentioned, just thinking back to that original graphic display of how violence against children is related to health outcomes across the lifespan, that's why the multi-sectoral approach with this survey is so important, because it touches all of these different parts of their life, and it's important to bring these appropriate ministries and sectors into the survey really from the beginning, so that everyone who needs to be there is engaged from the beginning. So, of course, social protection, but as well health, justice, education, the finance people, and the statistics partners to all come together and form a steering committee from the very beginning of the survey that will then translate through on the back end of the survey to prevention and response. So now just to tell a few success stories from the survey. I think still, again, among lay audiences, there's still this sense that violence is inevitable. There's not anything you can really do to change it or stop it. And this survey has some remarkable stories to discount that common belief. So Swaziland, again, now Eswatini, was the very first survey. And after the survey, they were able to create these domestic violence, child protection, and sexual offenses unit. It's a small country, but they didn't really have anyone within the police force trained to handle this, even though these are the first people that children who do seek services are going to. And so they created these units to provide child-friendly services for the children and their caretakers who came in for services. They established mentoring programs for girls in schools to really target those with the most vulnerabilities. They scaled up post-rape care centers and one-stop centers around the country. And then really importantly, they introduced 2 bills after the survey, a children protection and welfare bill, as well as a sexual offenses and domestic violence bill. Tanzania is another one of our earlier countries. They implemented the survey in 2009. And after the survey, we again saw this, this huge move amongst the government and key partners in the country to respond to the results that they found to be really startling. So again, there were training for police in how to appropriately handle abuse cases. And guidelines were created to establish gender deaths and children deaths within the police force. Child protection guidelines for school. I remember I was at the launch of the survey, and I was talking to a UNICEF colleague, and he said that they had been working with Tanzania, with the Ministry of Education for years, trying to get them to address corporal punishment in schools, and it had just always been a non-starter. But when the results came out showing that 3/4 of children were experiencing violence in schools, suddenly the Ministry of Education was ready to move on this issue when they were shown the data. And they created code of conducts and ethics for teachers and training programs to really teach positive discipline options rather than corporal punishment. And then finally, one-stop centers for post-rape care were introduced around the country. And then one more success story to share with you from Kenya. The survey was implemented there first in 2010 and then was repeated again in 2019. And I think this is really the most exciting thing that I'll say today, and that is showing that we had statistically significant declines in all forms of violence against children, both girls and boys, between these 2 time periods, about a 10-year time period. And so you can see that in 2010, about 1/3 of girls experienced sexual violence before the age of 18, and that essentially dropped in half. And for young boys, went from 18% to 16%. So a huge reduction of sexual violence in Kenya. Physical violence, again, we had significant declines across the time period, as well as emotional violence. And these are 2 cross-sectional surveys, so we can't assign causation, but we can look at what happened in the decade between these surveys, and there was concerted effort from the government of Kenya to address the issue of violence against children, and we saw these sharp declines in prevalence rates. And so I think another concern that people sometimes have is, well, if a country sees these successes like Kenya saw, then they might just sort of pat themselves on the back and say, okay, we've solved that problem, let's move on to the next problem. But in fact, the government of Kenya decided that the rates of violence were still unacceptably high, and they really did double down on the issue. And so using the INSPIRE technical package, they built on the response plan that came out of the 2010 survey and introduced a new plan, and it was really focused on these pillars within INSPIRE and on the evidence base that we are confident will continue to bring down the rates of violence against children in Kenya. And so, in conclusion, violence really is a global issue. It's highly prevalent in many countries, and it has profound impacts for those children who experience it, often across their lifespan, as well as across the social ecology. So collecting data, like what the Violence Against Children and Youth Survey do, is a really important tool, not just to shine a light on the prevalence, but more importantly, to catalyze action. And most countries that implement the survey do move forward with national action plans, or if they have one, as I mentioned, then they use the survey as an opportunity to really assess if the prioritization that they moved forward with makes sense, given the data. And I think, hopefully I leave you with a sense that, these surveys have shown that violence is prevention, and I think the slide from Kenya is pretty profound in showing that the needle can be moved quite drastically when there's an investment of will and there's financial support behind that will to really work to solve this problem, which truly is solvable. So thank you for your time, and that's all I have.
We have time for several questions. Are there any questions? Yes.
Thank you very much for the presentation. It's very, very exciting. I have a question about the VAX study, which is how do you inform the children about the study, and do you have to ask for the consent of the parents?
Yeah, it's a really good question. So the survey there were recommendations that came out of the WHO domestic violence survey that happened in the early 2000s, and those ethical recommendations were adapted to our survey. But essentially, when we go into a household, based on these WHO recommendations, we talk about the survey in very general terms when we're talking to members of the community and even to parents and caregivers. We just say, we're doing a survey on health and life experiences. We give them the information about it, and then we seek assent if the participant is younger than 18, or consent if they're older than 18, and give them the full information. In that process, we tell them, how long it will take, whether there are any benefits to their participation, and the sensitive topic. And so give them the full information, and then at that point, they can decide whether or not to participate. We're lucky in the countries that we've implemented the survey, we have very high response rates. Usually around 85 to 95% of the participants we approach agree to move forward with the survey. So very high. As I mentioned, we're piloting the survey in Baltimore in the United States, where usually household survey response rates are more like 60%. So we'll see.
Great. Another question?
Thank you so much for that great presentation. Very exciting work altogether. In the context of Kenya, for instance, I'm curious, but do you have any indications how the pandemic has also impacted the successes? And
yeah, that's a really good question. We know that the pandemic, well, we all know from personal experiences that it just upended everything. And we know in the violence field that it had serious consequences, particularly for domestic violence. But when it comes to children, I think it's a bigger question. Not as sure about Kenya. Our partner organization, Together for Girls, is going through a really in-depth qualitative analysis process right now to really understand both what happened between the two survey implementations, as well as what, happened during COVID. So I think we'll understand better then. But I will say we implemented the survey we repeated the survey in Eswatini in Swaziland with data collection in 2022, as well as in Ethiopia. And we asked questions about COVID, and so far those data are still embargoed, but so far it looks like we're not seeing quite as big of an impact from COVID as we would have expected, I think. So I think there were certainly risk factors with everyone being shut down at home, but there were also some protective factors that were perhaps, mitigating the effects that we think we might have seen.
Thank you. Thanks for that fantastic presentation. Really, really interesting. You talked a lot about girls and boys. Are you asking questions about sexual identity and behaviour and violence related to those? We've had so much in the news coming out of Africa in the last week.
Yeah, that's a really good question. We have a standard, a core survey, and we don't have those questions in there. Some countries have added them. Particularly, we have implemented the survey in a few countries in Latin America, and they did add questions around sexual orientation and identity. And in fact, we didn't see the strong relationship that we thought, but as a household survey, we were really limited by power with what we could do with those surveys. With those survey results. And the self-disclosure was pretty low, lower than I think we might expect. I think we're hoping for better data around that in the United States. But in some of these countries, it's really sensitive to ask those questions. I think everyone's aware what's going on right now in Uganda, for example. And when we implemented the survey in Uganda, we were very careful about how we asked questions like that because we really wanted to make sure that it was a safe survey for participants. So I think when you do surveys like this, you have to really be careful and weigh the benefits and the risks of what surveys to ask. There are other things like ethnicity or religion in some countries that are very sensitive, and so when it comes to looking at associations for these kinds of things, the country really has to lead the way on how to ask these questions, whether or not to ask them, how to ask them, and whether or not to do the analyses in these sorts of ways.
We'll take one last question, and I'm reminded that please identify yourself when you ask your question.
My name is Louise Arsenault, and I work at King's College London. Thank you for a great presentation, and I thought that your findings were really fascinating. You may have touched on this, and maybe I didn't pick on this, but I was interested to see the prevalence rates of violence that vary quite widely across different countries. And I wondered whether you could explain those kind of variances, and maybe especially whether there are cases of countries that have good practice that could be implemented in other countries. So you could see that Zambia was consistently kind of quite low, or lower anyway. Is it the case that there are some factors that prevents from getting higher rates, or is it the case that they have good practice in place that could be implemented, maybe upscaled in other countries? Thank you.
Yeah, it's a really good question and quite complicated. I think just now we're doing some efforts to look to combine data sets and look at this, more as a multi-country data set, which is going to produce some really interesting results. But as far as comparing countries to one another, we haven't done as much of that, but I think Zambia is a really good example of a country that actually has invested quite a bit in child protection, truly a leader in the region, and I would say in the world. So I think there are some things about Zambia that do, I think, make it quite a more protected environment for children. On the other hand, the early data out of Swaziland was quite alarming, and so I think we're really excited to get the repeat data out there very soon. To see if we've seen the same dramatic changes that we saw in countries like Kenya, where we repeated the survey. But I think, yes, there are countries where we have concerningly higher rates of violence, and as far as what goes into that, I think it's quite complex. But the other pattern that we're seeing is that when we first started the survey in 2007, we tended to see higher rates of violence there. And as we've done the survey across time, we've sort of seen the rates declining. And so as we've started looking into it, there does seem to be a global decline happening with violence against children. And that seems to match what's happened, what's, I think, more well documented in higher income countries like the United States, where we've also seen this decline, particularly of sexual abuse against children over the last 20 or 30 years. So I think it's a bit hard to unpack, but we do seem to be seeing some declines generally globally. As well, I think there are some countries where there are perhaps risk factors that make them places that are more dangerous for children. And then there are other countries where there's been a real investment in child protection systems that I think has been protective.
I'm sure that there are many other questions, and so we'll invite people to come and chat with you during the break. So thank you very much.
Thank you.